Hi, I'm Dr. Thomas Kropp, and if you're watching this video, you're considering or actually planning to have upper or lower eyelid surgery for cosmetic reasons. A lot of patients ask me, should I have a plastic surgeon do my eyelids or an ophthalmologist or oculoplastic surgeon? And basically either one will do a good job as long as they have adequate training. A doctor who is a fellow of the American Society of Ophthalmic, Plastic, and Reconstructive Surgery is board certified in ophthalmology and ophthalmic surgery and also has at least 1 or 2 years of additional training in plastic surgery of the eyelids. Your eyelids are often the first thing people notice about you and are an important aspect of your overall appearance. Young eyelid skin is smooth, but over time the eyelid skin stretches, the fat bulges, and the muscles may weaken. The eyebrows may also droop, and this is called brow ptosis. Loose or baggy lids detract from your overall appearance and make you look tired or older. When the brow drops, it can crowd more skin down over the upper eyelid and exaggerate the hooding and crow's feet at the outer corners of the eyes, making you look sad or tired. Surgery to improve the appearance of the eyelids is called blepharoplasty. The goal of blepharoplasty is to give the eyes a more youthful look by removing excess skin, bulging fat, and lax muscle from the upper or lower eyelids. The excess skin and fat are removed from the upper lid through an incision hidden in the natural eyelid crease. If the lid is droopy, the muscle that raises the upper lid can also be tightened at the same time. Lower eyelid blepharoplasty can be accomplished either through an incision inside the lid or beneath the lashes, depending on what needs to be done. Frequently, an incision is made in the skin at the outer corner along a crow's feet line to remove extra skin. Blepharoplasty, however, will not raise a droopy eyebrow. Because of this, in some patients, to get an optimal cosmetic result, they may need to have their eyebrows raised in addition to having upper eyelid surgery. This requires an incision somewhere above the eyebrows. This incision may just be what we call for a direct brow lift, which would be an incision directly above the brow. This has certain disadvantages in that the incision is visible and may be cosmetically unacceptable to some patients. The other alternative is to move the incision up in the hairline. A coronal brow lift, or basically an upper facelift, places the incision in the hair from ear to ear and pulls the entire forehead up. This can also be done with slightly smaller incisions and is called a small incision brow lift. The procedure is done as an outpatient. You will be asked to arrive 60 to 90 minutes before the procedure, and depending on how extensive the procedure is, it will take 1 to 2 hours. You'll be in recovery room for 30 to 45 minutes. In most cases, we use local anesthesia, certainly with some sedation. This allows me to have you open your eyes during surgery, and in many cases actually sit you up to judge the effect and get the most symmetrical and cosmetically pleasing result possible. If more extensive surgery like a forehead lift or upper facelift is required, general surgery may be better. Before surgery, you will receive a list of detailed instructions. This will include stopping aspirin and other antiplatelet meds like ibuprofen 2 weeks before surgery. Coumadin and other blood thinners will need to be stopped as you will be directed, and if necessary, medical clearance by your family doctor or cardiologist will be obtained. You'll be asked to cleanse your face with antibacterial soap the night before and the morning of surgery. After surgery, or post-operatively, you'll be asked to use cold compresses. This is important for the first 36 hours to minimize swelling. We will start them immediately in the recovery room, and you'll be asked to continue them at home at least 15 minutes out of every 60 minutes that you are awake. This can be done in a number of ways. One easy way is to just take ice and mix it with water and rinse out a washcloth and put it over your eyes. You may get the commercial gel pack from the pharmacy and keep it in the freezer, or even a bag of frozen peas wrapped in a wet washcloth works very well. You will be given an ointment to use 2 times a day in your eyes for the first 2 days to keep them lubricated, and then nightly until seen in the office. You'll be able to use your artificial tears as needed. And it's okay to shower and shampoo the day after surgery. Just be sure to gently dry your eyelids and not scrub them. In most cases, I use absorbable sutures, but if I decide non-absorbable sutures are better for you, they will be removed in 7 to 8 days after surgery. Light activity is okay, walking, things like that, but we want you to keep your head elevated for the first 36 hours, sitting in a chair or sleeping on at least 2 pillows at night. This also helps minimize swelling. Generally, we don't want you to do any strenuous activity for the first 7 to 10 days after surgery. Other specific instructions will be given to you after surgery. A lot of patients are concerned about the pain following surgery, and fortunately it's generally minimal. Most patients get by with just extra strength Tylenol. However, if you feel something stronger is necessary, this can be prescribed. You can resume your aspirin products the second day after surgery, and you will get specific instructions on when to resume Coumadin, but generally it's okay to start this the morning after surgery. As in any surgery, there are risks, and a few of the more important ones include mainly visual loss. Fortunately, this is very rare after eyelid surgery and is usually a result of patching the eyelids with pressure patch and putting too much pressure on the eye. This is why we use cold compresses exclusively. Dry eyes can be a problem, especially if they were a problem before surgery. In fact, if you have severe dry eyes, I may tell you you're not a good candidate for cosmetic eyelid surgery, or that you may need to lower your expectations. It is rare, but sometimes you may need to use lubricating ointment for a month or 2 at bedtime. You certainly may notice an increased need for artificial tears because your eyes are now going to be more open. As in any surgical procedure, infection is a possibility. Fortunately, this is very rare in eyelid surgery because the blood supply is so good. You know, men cut themselves shaving all the time but hardly ever get infected, but it bleeds a lot because the blood supply is good. Of course, the downside of the good blood supply is bruising. This is expected after eyelid surgery. It's variable between patients. Another complication of cosmetic eyelid surgery is overcorrection. Fortunately, in my hands, this is rare because my philosophy is to be conservative with your eyelids. You can always do a little more, and it's easier to do that than try to fix something that has been overdone. If too much skin was taken off your upper or lower lids and you can't close your eye or your lower lids are pulled down, this is a significant problem. To do a little more is usually a minor procedure done in the office at no additional cost. The timing of fixing or correcting an undercorrection is usually 1 to 12 weeks after surgery, depending on what needs to be done. Cosmetic eyelid surgery is generally very rewarding to the patient and the physician as long as it is performed by a surgeon with significant experience. I look forward to the privilege of being your surgeon, and thank you for taking the time to watch this presentation.